Okay, so I welcome you all for today's free webinar. This is for VT, the most difficult guideline, I would say, in all the GTGs. So let's discuss it and try to solve few questions so that some of you will revise, and for some of you, it will help you in memorizing further. So I welcome you all from MRCOG. I'm the course director and founder of MRCOG. Presently, I'm working in Barts NHS Trust, London, UK. So yes, MRCOG do help you in changing your career path, in making you, giving you a different way of success. But it's not like what you are doing presently is also great. Preparing for exam also give you knowledge. So in a way, it's a good thing to keep updated about the knowledge. I would like to congratulate on this occasion the first batch successful student, which is always near to my heart. Now, the exam calendar, if we see, July exam is on 5th and 24 January exam is on 17th. So for January exam, students should prepare from now is also important, as we started for July exam in January itself. So it do make a difference to start at the right time, because the course is vast. You need time to prepare. This is the 11th batch from MRCOG, and I'm very happy with the success, with the student satisfaction with preparing with us. I hope you all know about how to prepare and how to go about GTG talks, tips of solving questions, what material to follow. These all are there already in different introductory sessions, so I'm not going through that. But if anybody has any query, they can always message me in the comment section, and I'll be happy to answer any queries. But right start matter the most for the confidence before exam. Key to success, definitely little effort each day. And for July exam, now 2 weeks left, so you have to be really calm is most important thing now, because don't try to revise each and every time. Give your brain little break to relax in between, because don't burn out your brain from now. Be energetic on the day of exam is very important, so try to do that. But yes, definitely the hard work, smart work, dedication, determination, consistency, focused approach, group study, daily discussion, and right schedule help you in succeeding the exam. Balance of reading and question solving, I can't overemphasize. This is the most important thing, because ultimately the exam will be in the form of questions. So a course can help you in many ways. It can make your path easier because you're working and preparing, as well as you can give mocks and somebody's there to guide you. So it helps. These are what AIM-MRCOG started first time, EMQ sessions and talk sessions, which students has really appreciated. So hopefully it makes life easier for every student who joins. This is our Jan course, which is starting now, and the first live session is next weekend. For next 48 hours, you can join for £325, and it includes the free crash course as well. These are the course features. So that's all about the Jan course, which is starting now next week. Now let us discuss about the VT guideline, which has come in 2015, and there is no exam which goes without question from this guideline. Why they always ask question from this guideline? In spite of knowing that everybody is having recall questions, and they know these kind of questions are asked, because still it is challenging, still it is confusing to remember and reproduce in exam. So always the difficult things keep coming in the exam for you to test your memory, basically. It's not only about understanding. This guideline is also about memorizing something very thoroughly. So if you see VT in pregnancy, 1 to 2 per 1,000 women have VT in pregnancy. So sometimes they ask you incidences. So you should have a rough idea about some important topics which are always favorite, like VT, like sphincter injuries, like sepsis, like stillbirth. These are very favorite topic, because the thing which they are not able to decrease. Now, if you see the recent Mebris report, which recently I have posted in YouTube, they have seen that they can't reduce the VT deaths still. So they know that this is the first direct cause of death, the most common direct cause of death. But they're trying hard, but still they are not able to reduce the VT deaths. So that's why it's become important that you know the guideline in and out, because if you know it, then only you will do the right management of patient, and that's how you can avoid it. So VT is always a favorite topic. That's why. The same way stillbirth is always a favorite topic. There are many twins, multiple pregnancy. There are many which are commonly asked in the exam. So we should choose wisely now, because exam is nearing. I've already posted in the Telegram group the important topics according to the recalls. So that topic, that guideline are the one you should focus now, rather than focusing on some talk or some guideline which are not commonly asked. Yes, you have read that earlier, you have prepared that earlier, you are ready with that. It's there in your remote memory, leave it there. Now, this is the time to revise important topics, not all topic. All topic you have prepared, now it's time to revise the important ones. Because it's practically not possible to revise all, isn't it? Now, the UK incidence of antenatal PE, if you see, it's 1.3 per 10,000 maternity. So these are the incident numbers. The risk of VTE increase with gestational age, reaching a maximum just before delivery. So yes, VTE increase with gestational age, and its maximum just before delivery. So we know that VTE in the postnatal period is further higher than antenatal period. But if they ask you in pregnancy when it is highest, so then it will be third trimester. But because it's all wordplay in exam, sometimes they will ask you when is the highest risk of VT. If they ask you first, second, third trimester and postnatal, you'll choose postnatal. If they ask you which is the most common risk of VTE in pregnancy, then it will be in third trimester. So keep that in mind about the wordplay. Be mindful about the wordplay in the exam. Question reasoning is the biggest art for the exam. Basically, it's not the preparation is lacking. It is basically we are not able to comprehend the question, understand the question, and then answer it. You remember it, but because of the wordplay, sometimes you don't get the question correctly in exam, in anxiety. So very important that read the question with a calm mind and gather in your mind, and then answer the question. So that way you will be able to give your best in the exam according to what you remember, because nobody can remember 100%, but that's all right. We don't have to score also 100%, isn't it? So there is some scope of missing something from the memory. That's all right, but we should try harder in these last few days. We should look all the flashcards, all the important charts of the guideline, because most of the question comes from there. So if you see, there is a 4 to 6 fold increased risk in pregnancy of VTE. And if we go postpartum, it's further 5 times of antepartum. So that's the important thing. Now, this chart, the risk factor, very important to memorize. You have to see what number where, because ultimately the VT prophylaxis decision will be according to the numbers. So if there is previous VTE, but then every single word of this guideline is important, and believe me, even during my preparation, many times, all the charts I have seen, and I will solve a question, and then if the answer is not again. So these charts are some charts which are really difficult to memorize, because each and every word you have to memorize. So what you have to do for a previous VTE, the score is 4, so she needs prophylaxis from the beginning of the pregnancy. As soon as she becomes pregnant, she should get the VT prophylaxis. Now here there is an exception, a single event related to major surgery. What does it mean? If she had a hip surgery and she was bedridden for a longer time, and then she had a DVT, that doesn't mean that her body, her blood is prone for producing clot. That was because she was bedridden for a longer time. So this is an exception. That's why it doesn't get a score of 4. any major surgery leading to previous VT, get a score of 3. So you have to be mindful about this. Previous VT happened when and how is important in the history. So in question in exam, thankfully, RCOG is very kind in giving very clear scenario, and they always give you a hint where they're taking you. Okay, so if they are emphasizing that she had a previous VT during this, that means they are trying to provoke your remote memory of this exception. A single large event related to major surgery, get a score of 3, not 4. You will remember in exam, you have to understand in exam, our mind is very much stressed. So the more relaxed you are, the more you will be catered from your remote memory. It's not about acute memory. The exam is given all by the remote memory, all by remote understanding. And there is always a hint in question which help you in solving it right. So previous VT, get a score of 4, but previous VT provoked by major surgery, get a score of 3. So if the score is 4, she needs prophylaxis from the beginning. If the score is 3, she needs prophylaxis from 28 weeks. So that's the difference. That's the major difference, because they always ask you when to start, right? When to start the prophylaxis. So that's why this is important. Then comes the known high-risk thrombophilia. Now, this is very important that you memorize the list of high-risk thrombophilia, like AD3 deficiency. AD3 deficiency increase the risk of thrombosis from 15 to 50%. So up to 50% it could. So it's a high-risk thrombophilia. The same way the homozygous pattern, the protein C, protein S deficiency. So there is a list in the guideline about the high-risk thrombophilia, which you should remember because that gets a score of 3. So if they have that, they need prophylaxis from 28 weeks. Very, very important. Then comes the medical comorbidities. Medical comorbidity is very, very important because when we are reading the question is very long. Unless we know that it contributes, we won't be able to gather that information from the question. So if there is a previous cancer, if there is a cancer means there is a hypercoagulable state in cancer. Heart failure means there is a stasis lead to thrombosis. SLE leads to hypercoagulability because of inflammation. Inflammatory polyarthropathy, inflammatory bowel disease. So these are inflammatory condition make the blood hypercoagulable. That's why it's important. Nephrotic syndrome, type 1 diabetes with nephropathy, sickle cell disease, very, very important, and recent TOG article about sickle cell thalassemia, very, very important. Current IV drug user. So these are the one, it doesn't come in our mind unless we remember it well. So if you understand it, that why they are making hypercoagulable, you will be able to remember it well. And when you read in the question, you know, okay, there is a column which get the score of 3 of comorbidity. So I should gather this information and this will be the score. Because in reading the large scenario, sometimes we forget she has a history of this. What's the significance of that? So very, very important to memorize. Score 4, which is simple, previous VT, but remember the exception. Then score 3, you have to remember well. Then score 3, transient. Transient means for a small time and then it will go away. So she doesn't need it for full pregnancy or full pregnancy and post-delivery. She needed only for that transient time because the risk is only at that time. So any surgical procedure in pregnancy or puerperium, except repair of perineum like tear repair or episiotomy repair doesn't give an extra risk, but any other surgical procedure will get a score of 3. So if she has undergone postpartum sterilization, appendectomy, then it gets a score of 3. So remember that. Hyperemesis score of 3. So this is only for transient period. So when the patient is admitted, like a patient got admitted for postpartum sterilization, she's staying, she's an obese lady, she is not getting up and walking. She's even after a small operation, she's staying on the bed for 2 days. So till she's in hospital, you're going to give her the prophylaxis. For hyperemesis also, till she's in hospital because she's dehydrated, there is a risk of thrombosis. So you want to give them prophylaxis when they are admitted in hospital. Once you discharge them, no need of giving because then they are hydrated, then they are no more vomiting, then they are mobilizing. So Dehydration is something which leads to thrombosis, is what you have to keep in mind. Sometimes they will give you the postnatal scenario that it's a very common question in exam, that postnatal women who is breastfeeding, and breastfeeding is saying you that she has to hydrate herself well because she's breastfeeding, and then they give you some headache thing, that she developed headache. Then always think about thrombosis. Then it could be a CVT, it could be a thrombotic headache. So that's important. They always give you some things which hint you towards what are the risk factors. So what could be the reason for this headache? What could be the reason for this symptom? Finally, what could be the diagnosis? So it's important to understand the scenario all well in the question. So hyperemesis get a transient score of 3, surgical procedure get a transient score of 3, and then OHSS. OHSS is very, very important. This is a very common question in exam also nowadays. But OHSS is score 4 only in first trimester. So you will be giving thromboprophylaxis only in first trimester. In recent talk they have given, there is a gynae thromboprophylaxis talk I have recorded in the YouTube recently. If you go through that, you will understand that OHSS increase the risk 100 times. So you have to give for full first trimester, but not in second or third trimester. So keep that in mind, because they will give you an exam, OHSS lady, IVF pregnancy, this, that, many things, and then you are scoring your patient, and then you forget that she has OHSS, so already the score is 4. So for OHSS, she will get full first trimester is what you have to choose sometimes. So be very precise about what is given in the question to choose your answer correctly. So if we have done 4 and 3, then there are only few 2s like cesarean section in labor or obesity more than 40 BMI. These are the only 2 which get a score of 2, and then remaining all get a score of 1. So in score of 1, the age, the parity, smoking, gross varicose vein. Very, very important for you to understand gross varicose vein. If they will give you an exam only varicose vein, you will give it a score of 1. But sometimes they will elaborate about the varicose vein. That varicose vein is only in the ankle and you have noticed it while examining. That means they are pushing you towards that this is not a gross varicose vein. So it doesn't get a score then. But otherwise, if they're kind enough, they will simply write varicose vein and you can score it. But if they're describing varicose vein, then you should know what is gross and what is non-gross. So gross means anything goes above the knee, anything which is painful, symptomatic, because varicose vein means dilated vein visible. If it is only near the ankle, you noticed patient didn't come with the complaint of pain or something. You noticed it on examination. You will not give it a score. But if the patient comes to you complaining she has the pain in the area and it's going above the knee, symptomatic above the knee is significant, that means gross varicose vein, which will get a score of 1. So these are the hidden things which are written in the guideline, not in this chart, which you should memorize well. And then the pregnancy related thing and then the labor related thing get a score of 1. And then the infection, immobility, dehydration get a score of 1. So first of all, this chart has to be memorized well so that you can score, and accordingly you can give them the prophylaxis at the right time. So if the score is more than equal to 4 from first trimester, if 3 from 28 weeks, if more than equal to 2, at least 10 days postnatally. Now some of the book question you will see for 7 days that are very, very old, because that is from the old guideline where postnatal prophylaxis was for 7 days, like sickle cell anemia and thalassemia guideline. It's 7 days because it's old guideline. And then the talk now has come is the new talk, and some things have been changed in that talk. So it's important for you that don't sometimes run behind the question from the book which are having wrong options, because that is from the old guideline and it's not updated. Okay, so this is the antenatal assessment chart. We have already discussed about the risk factor, and accordingly you will get a score and when you're going to start. So let's do some questions so that we understand. Are we able to apply this knowledge to the questions? Okay, who wants to read this?
Yes,
May I,
ma'am.
ma'am?
Yeah, go ahead.
Hello?
Yeah, go ahead.
A 24-year-old
24-year-old
woman.
woman.
Okay, one person now and one for the next question, please.
Okay, a 24-year-old woman in her a 24-year-old woman in her second pregnancy presents at 12 weeks of gestation with confirmed venous thromboembolism. How would you advise her with regard to her treatment? So this is the case of confirmed VTE. So we have to treat her. So how would you advise her with regard to her treatment? Comments warfarin, comments therapeutic low molecular weight heparin, comments therapeutic low molecular weight heparin. The option D, ma'am. Commence therapeutic low molecular heparin for 3 to 6 months.
And then convert to a prophylactic dose. This is what you want to do?
Or, ma'am, E also seems correct, ma'am. E and D and E.
But in exam, you have to choose only one. So what do you think?
I'll go for E, ma'am. Commence therapeutic for the entire pregnancy.
Yes. So very good. You'll go for E because E is also correct. The thing is, sometimes in exam, you think that two options are looking very close to you, but then you have to again unfold your mind that let me memorize what is written in the guideline. So whenever you read the question first, Sudeep, you have to have the answer in your mind. So you read that 24-year-old woman, second pregnancy, 12 weeks, confirmed DVT, right? So if she has VT, means she needs therapeutic dose, low molecular weight heparin. Now, what they say in the guideline is you have to give it for entire pregnancy and post-delivery 6 weeks. This is what the guideline says. Now, the guideline also says that you have to give at least 3 months of therapeutic dose. So where it applies is in the end of the pregnancy, like somebody comes to you at 36 weeks or 38 weeks with VTE. So how long you're going to give them therapeutic dose is at least 3 months of therapeutic, and then change it to the prophylactic dose or whatever they will decide. Maybe change it to warfarin, or that is the call of hematologist. But in the guideline, they have clearly written at least 3 months of therapeutic dose. That doesn't mean that if she come to first trimester, you are not going to give her for full pregnancy, because we saw that previous VTE you are giving in this pregnancy throughout the pregnancy and postpartum. So how can a fresh VTE won't receive full pregnancy and post delivery? Am I making sense?
Yes, ma'am. I got it.
Only difference is the dose. For previous VT, we are giving prophylactic dose, and for confirmed VT, we will be giving therapeutic dose throughout the pregnancy. This is what we have to memorize, and throughout the pregnancy as well as the post-delivery, because post-delivery is further higher risk. So be clear about that. This is a common question in exam as well as confusing question in the books. So this will help you memorizing. Okay, next, who wanted to read?
Okay.
Thank you, Sudeep. Yes, who wanted to read earlier can open their mic.
May I, ma'am?
Yeah, who is this?
Hari, ma'am.
Harim, go ahead, my dear.
A 29-year-old Egyptian woman, Gravida 2 para 0+1, attends the antenatal clinic at 13 weeks of gestation. Her BMI is 30 and she gives a history of previous venous thromboembolism during the post-operative recovery period following a thyroidectomy operation. Okay, so ma'am, she has a history of previous VTE which is related to a major surgery. So that is a score of 3. So we would give her low molecular weight heparin at 28 weeks of gestation. So, okay, we will choose from option C and D. And
very good. So this way you can decrease your time because you already got 2 options. Now, which option you will choose?
And 6 weeks postpartum, because she has a history of VTA, so that's a score of 4 for postpartum as well. So option D.
Okay, very good. Your answer is correct that you will give her 6 weeks postpartum, but the reason behind that is any women receiving antenatal prophylaxis will receive postpartum prophylaxis for 6 weeks because we saw the risk in postpartum women is 4 to 5 times higher than the antepartum. So if you have given an antepartum, that candidate is requiring postpartum for 6 weeks. So in exam, they will always confuse you saying 10 days, 6 weeks. You will think that what do I have to calculate again the postnatal risk? No need. If you have given anybody antenatal thromboprophylaxis, they are going to receive for 6 weeks postpartum. So postpartum rules are different. We will revise that at the end of question as well. So don't mix it up. For the postpartum, you don't have to do a different scoring. If any women receive antenatal thromboprophylaxis, she will need 6 weeks postpartum thromboprophylaxis for sure. Okay, who wants to read this?
Ma'am.
Who is this?
Hello, Ma'am Suvarna.
Suvarna, your voice is very low, my dear. If you can increase your computer sound.
Is it okay now, ma'am?
Little more louder if you can go.
Yes, ma'am. 36 years old, at 12 weeks P1, her BMI 47 and no past medical or surgical history. What advice for prophylactic VT? Ma'am, 36 years, so she will have score of 1. BMI 47, so she will have score of 2. So total 3 score. So again, the from 28 weeks to 6 weeks postpartum, ma'am. D.
Very good. So they always, this is not in recall, this is a recall, so definitely it's 2-liner, but in exam it will be a 5-line question. They will give you many things, many distractor, many useful things also. So you should always grab it. So this is what somebody grabbed it from the question, that she was, the age was a risk and BMI was a risk and no history of any illnesses. So that way she got a score of 3. But we don't know. In exam, there will be some other risk factor. I don't know. So in exam, be careful. You have to start from the beginning. Age, BMI, parity, smoker, varicose vein. These are in the beginning. And then the medical history. Then she might be preeclampsia, multiple pregnancy in this. Then labor, was it a prolonged labor more than 24 hours? Did she receive blood transfusion, more than 1 liter of PPH? Did she receive blood transfusion? That get a score. If she get a mid cavity or rotational instrumental delivery, she get a score. So it should be so clear in your mind from the beginning till delivery that you can easily score 1, 2, 3, 4, 5. It's very important. What happens sometime in exam is they give you more than 3 risk factor for postnatal lady, because in the exam for postnatal they have mentioned that if the score is more than 3, consider giving it for 6 weeks. So sometimes they give you 5. In postnatal, if they give you 5 means they are directing you towards that the score is more than 3 and she needs 6 weeks, not 10 days. So be careful about reading the question and collecting your scores. For postnatal, especially if many risk factors and its score goes beyond 4, 5, means they are taking you towards 6 weeks rather than 10 days.
Yes, ma'am.
Okay, well done. Yes, who wants to read this?
May I, ma'am?
Yeah, go ahead.
A 26-year-old woman, gravida 1 para 0, attends her antenatal clinic at 11 weeks of gestation with a previous history of unprovoked VTE. She is known to have antithrombin deficiency. Okay, so in this scenario, ma'am, she has an unprovoked VTE, that is a score of 4, so we would give her low molecular weight heparin for the entire pregnancy, but she is known to have antithrombin deficiency, so we would give her low molecular weight heparin at high doses, at 75% of the treatment dose from the first trimester and continue until 6 weeks. So option B.
Very good. So here you have to understand that women who have high risk thrombophilia, as I told you, 83 deficiency is 15 to 50% risk. So they say that you have to give a higher dose. So it could be 50% higher, 75% higher, or even 100% higher. So sometimes they will give treatment dose. Everything is acceptable. Not necessarily they will give you the same. They might give you 50% higher. They might give you therapeutic dose sometime. So it depends on the risk. If 83 deficiency, if recurrent VTE, if VTE with APLA, in such situation, you have to give a higher dose of prophylaxis, which could be sometimes even therapeutic dose. So it could be for a 50 to 90 kg women, it might be 40 BD is what they will sometimes give you with 83 deficiency. So be careful. You can choose therapeutic dose, but don't choose 40 milligram OD, which is prophylactic dose, because you have to give a higher dose. So it could be therapeutic, but it can't be only prophylactic dose, which won't be correct. 50% higher means 40 and 50% higher become 60. 75% higher means further higher. 100% higher means 40 become 80. So keep that in mind. Okay, who wants to read this? Yes, anyone can read. Anyone who wants to practice can read. Don't worry here, we are not here to judge anybody. It's just for practice and learning from each other.
Yeah, ma'am.
Nobody. Yeah, go ahead.
A 22-year-old primary gravida attends for post-dates induction of labor at 41 plus 5 weeks of gestation. At booking, her BMI was 32. There is no significant past medical history and she has been well antenatally. Following induction with prostaglandins and syntocinon, she had a normal vaginal birth, although the placenta was not delivered for 50 minutes. The blood loss was estimated to be 1300 ml. What is the most appropriate postnatal prophylaxis method for this woman? Okay. Her booking weight was BMI was 32. So BMI more than 30 is one risk factor.
Go
Okay,
ahead, you
and
are in exam.
there's no significant past mystery following induction. And PPH more than 1 liter is another risk factor. 2 risk factors. Let me read again. 22 primary. Okay, induction at 41 plus 1, 5 weeks. No significant past medical following induction. All this. Okay, so ma'am, I see 2 risk factors, and for 2 risk factors, I think I'm missing some disorder. I think I'm stuck, ma'am.
Yes, so this is what you don't want in exam. Why you have to
Yeah.
overanalyze? You saw 2 risk factor, now your brain is not going to think anymore. So whatever you have decided for the first time is right. Don't think too much. Because if you will think
Okay.
too much, then you will think, oh God, did I do this correct or not? And then you will carry that baggage to the next question. No need. It's just a question. You read it one time, you got 2 risk factor, you got score of 2, and there is an option fitting that. That means you are right.
Okay.
Don't give yourself second thought too much. Don't overthink in the exam. Some questions are really, really simple. So not all questions are complicated in exam. Some are really simple and you can simply do it within seconds because you remember it well. So if you got the answer too quickly, don't doubt yourself that you're not right. In exam, we overthink, right? We all have the habit of overthinking in exam. How can it be so simple? No, I'm missing something. Like you thought, this long scenario, maybe I'm missing something. But in exam, you have to finish it in time. You don't have time for, especially for SBA, you don't have time to think again and again. In one reading, you get all the factor from SBA, you get an answer, you take that. And believe me, 99% of the time, first thought is a correct thought. So until unless something come in your mind, like you are relaxed now, you have finished the paper and then you memorize something, oh, that question, I think I should change. Think 2 times before changing the answer. Think 10 times before changing the answer. If you're very, very sure, then only change the answer, because whenever your brain tells you the first time, most of the time, 99% of the time, that is a correct answer. And don't doubt yourself. Some questions are really simple. You're practiced enough, it will be easier in exam. So don't doubt yourself is what. And don't carry the baggage to the next question, because once you fumble, then every question you will fumble. So no need of fumbling. The exam is just to give what you remember. Don't think of making wrong. It's acceptable to make wrong. So don't get afraid of making wrong. Just do what you can remember. It's okay. God will help you in the exam to keep you calm, keep yourself calm, and give it like you're sitting in your room giving just a paper, like you are giving mocks, like we are practicing mocks, like you're sitting in the home and giving mocks. The same way you have to give the exam. That will give you the best outcome, believe me. Okay, who wants to read this? Come on, let's read it quickly so that I don't have to tell again and again. Somebody, anybody can read.
36-year-old female, 36-year-old female, twin pregnancy, IVF. What is the VT prophylaxis? And her weight is 45 kg. 36 years means score 1. Twin pregnancy score 1. IVF also 1. And 45 kg is score 2. So there is 2, 3, 4, 5. So we'll give LMWX from now. Option D.
Okay.
Hello?
Okay, Sudeep. Now you told me 45 get a score of 2. She's 45 kg, not 45 BMI.
Oh. Okay, then score 3.
So you
36
saw
years score
how
1.
you remembered everything. You are very intelligent. You remembered everything. But while reading question, you misread it, right? Why you misread it? Sometimes
Yes,
either we are anxious where we can't see because something else is going on in our mind. So that's what you need to do in exam. Focus. Just for that 3 hours, just forget about everything. That's what I'm telling. Keep your mind clear. Allow your mind to think. Allow your eyes to see. Don't assume things. Don't read in between the lines. Only read what is written, and be confident is what is very, very important. You be confident that I am going to pass this exam. That's how you can pass the exam. First of all, you should believe in yourself. Then only you'll be able to perform best. And I know you're very intelligent, Sudeep, and you always remember things well. So don't confuse yourself for silly reasons. Just be confident.
Okay, ma'am.
This is what you need right now.
Yes.
So that will really help. So like this, like the question is very simple, though this is because this is in one-liner, maybe that's a confusion once you read the long scenario. Maybe you would have not made this mistake. But as I'm just giving the tips even for the exams to everybody, that overthink is also very dangerous, and having confidence is really, really important. Even if you are prepared or not prepared or whatever you have done till now, if you are giving the exam, give it with the confidence that you will pass it, and believe me, you will pass it. So
Thank you,
if you
ma'am.
are giving the exam, give it your best shot. You can give it only by, first of all, feeling yourself that you're confident. So the score is 3. That's why, from 28 weeks. And because they have given 45 kg, nowadays they are giving the dosing question also, like they will give 45 kg or they will give more than 90. Usually they will give less than 50 and more than 90, because 40 to 90, 50 to 90 is the regular dose of 40 milligram, which we are usually using. The pregnant women usually fall in that weight range. So less than 50 and more than 90, at least you should remember well, because that are also very common nowadays, because BMIs are so much increasing. So dosing, that's why they have given 20 specifically. So I'm thinking that, and even there is a recall question about more than 90 kg. Many recall questions nowadays are coming for doses. So doses remembering is also important. So if you see the dosing, 50 to 90 most common age group, most common weight group in pregnant women will be 40 daily. Then less than 50 will be 20 daily. 90 to 130 will be 60 daily. And we do see here the BMI 50 and many more. So more than 130 will be 80 daily. Now they say that if more than 90 kg, you can give them in 2 divided doses. That means more than 90 here will get 30 BD and here they will get 40 BD. So you will think that it's a treatment dose, but actually for her weight, it is a prophylaxis. If the weight is very high, which this high they shouldn't give an exam, but if they give like that theoretical question, then it will be 0.6 milligram per kg. So this is what you have to remember really, really well. And sometimes they will not give you enoxaparin, but give you deltaparin, tinzaparin. They will give you relation to the renal failure and things like that. In renal failure, you have to adjust the doses. And you have to remember the doses for these also. Because nowadays they are asking the not only enoxaparin, but deltaparin and tinzaparin as well. Because they have to make new questions from the same guidelines. So definitely they have to focus on some other areas. So you have to memorize all the doses as well. Now, if you see the high prophylactic dose, which we talked about 83 deficiency, is 40 milligram 12 hourly, which is a treatment dose for this weight, right? So as I told you, it's 50, 70, 50%, 75% or 100% higher. So it could be therapeutic dose also. So don't get confused by that in exam if they give you that dosing for 83 deficiency. Okay, EMQ, let's see who wants to read this.
Ma'am, me?
Yeah, go ahead.
25-year-old woman, G2P1, attended the maternity unit with no fetal movements for 24 hours. She had a spontaneous vaginal delivery of a macerated baby after rupturing her membranes and going into spontaneous labor. She has a BMI of 20 kg per meter square and smokes 8 cigarettes a day. She is about to be discharged home from the labor ward. So for age, there is no score. Even for parity, no score. But as she has got uh, macerated, so even that is not a score, ma'am. The fresh stillbirth will have a score. And as for smoker, she will have one score. So she will just have that advised on mobilization and avoidance of dehydration. J, ma'am?
Go ahead, you are an exam.
A 31-year-old woman had a normal vaginal delivery of a male infant 4 days ago. She has been readmitted to hospital with mastitis for which she had antibiotic and about to be discharged 4 days after admission. This was her first pregnancy and her BMI is 27 kg per meter square. So again for age, she is not having any score, vaginal delivery normal and readmission, so that will have a score. So only for admission, she will have one score, ma'am.
So does admission get a score of 1 in postnatal?
No, she needs to be given this LMWH till the time she is hospitalized.
So what you will choose?
Ma'am B, LMWH for 10 days.
Yes, because there is no other options. And if you see the postnatal chart, I'll just show you. Sometimes you might forget something in exam, right? You might forget something in exam, but it's all right. When you read it, I will show you it. Yeah. So if you see readmission or prolonged admission more than 3 days in puerperium will get an intermediate risk and 10 days. As I told you, postnatal doesn't work actually on scoring. The scoring system 4-3-2-1 is more for antenatal because in postnatal there are many exceptions. Even score 2 will get for 6 weeks. So you have to memorize this chart well, where what is written. Like if you see cesarean section in labor, get a score of 2, BMI more than equal to 40, get a score of 2, so intermediate risk. Readmission is intermediate risk and you have to give them for at least 10 days. Any surgical procedure except repair of puerperium, again, 10 days at least. Medical comorbidity, 10 days, but if prolonged morbidity like SLE, cancer, it is not going to disappear. It will be there forever. Type 1 DM with nephropathy, sickle cell disease. So you have to give for 6 weeks. If more than 3 risk factor, you have to give for 6 weeks. So for postnatal, you have to memorize the chart, this category, and this is the scoring. So scoring is different, but this categories you have to remember when. Like any previous VT will receive for 6 weeks. Anyone receiving antenatal will receive for 6 weeks. Any high-risk thrombophilia, which is score of 3, will receive antenatally, so obviously for 6 weeks postnatal. But if you see the low-risk thrombophilia and family history, both are score 1. This is the only exception. That's why they always ask you this in exam, where the score is 2 and still they get 6 weeks. So this is different than antenatal charting. So postnatal, you have to memorize this, at least these 2 columns, and then the difference here, like cesarean section and IVF pregnancy is not there here for postnatal. So be mindful about that. And the delivery related risk factors are added for postnatal. So be careful about that.
Yes, ma'am.
Now here, because the stillbirth get a risk, stillbirth in this pregnancy will get a score.
But even the macerated old IUD will also get a
Whatever
score,
it
ma'am.
is, but the baby delivered at that time, baby was stillbirth, isn't it?
Okay. I thought
So
straight
stillbirth
stillbirth,
will
ma'am.
get a score and smoker will get a score, so it become 2.
Yes, ma'am.
And again here, because she's readmission, it's written in the guideline, you have to give for 10 days at least. So that's why you have to give for 10 days.
Yes, ma'am.
Okay, who wants to read this? Thank you, my dear.
Thank you, ma'am.
Yes, anyone wants to read?
May I, ma'am?
Yes, go ahead.
Okay, choose the appropriate management. A 30-year-old woman with a BMI of 24 is about to be discharged home after delivery of her first child. She had an uncomplicated vaginal delivery with a baby weighing 4.5 kg. She has gross varicosities on both legs. She has only one risk factor, which is gross varicosities. So we would advise her early mobilization and avoidance of dehydration, option J. Question 2. A 28-year-old woman. Sorry. Yes, ma'am?
Yeah, go ahead. You think you are in exam and just you go ahead.
Yes, ma'am. A 28-year-old woman with mechanical heart valve is being discharged from home after the delivery of a third baby by forceps. The estimated blood loss was 1100. She delivered 8 days ago and had stayed in the hospital as a baby was in the neonatal unit. She is on anticoagulation. She wants to continue breastfeeding her baby. Okay, she is 28 year with mechanical heart valve and discharge. Estimated blood loss more than 1100, so that's one risk factor. Stayed in the hospital as a baby, was in the neonatal unit. This is another risk factor because more than 7 days. She wants to continue breastfeeding. Low molecular weight heparin for 6 weeks, ma'am.
Go ahead, you are in exam.
A 21-year-old dancer has had a preterm delivery after spontaneously rupturing her membranes at 33 weeks. Okay. She went into spontaneous labor while being managed conservatively. Her BMI is 21 and this was her 4th pregnancy after having 3 previous miscarriages. Okay. And as part of the investigations for miscarriage, she was found to have antithrombin deficiency. There is no past or present medical condition of note. Okay, preterm delivery is score of 1. After spontaneously rupturing, she went to spontaneously. This was a 4th pregnancy, but miscarriages, so parity is not going to be counted. Okay. She has antithrombin deficiency. But they haven't mentioned whether it was high risk thrombophilia or what. Okay, antithrombotic is major risk factor. So we will continue low molecular weight heparin for 6 weeks. Option H. Sorry, A.
Which,
For 6 weeks. A. A. A.
so your answer is J, and then you told what was your
J,
next?
A, A. Actually, not sure about question number 2, but I said A for 2 and 3 both.
Okay, fine. So
In question number 2, I'm just confused.
no problem. It's all right. Only thing I want is in exam, if you are getting 2 out of 3 EMQ correct, don't get stressed up. It's all right. 2 are correct. At least you're sure 2 are correct. It's all right. The giving exam strategy should be easy on your brain, be easy on yourself. This is very important to tell and very difficult to do under stress situation. So this is the key, Harin, in exam. Don't panic. Panicking doesn't help. Don't panic. It's all right. You are at least confident that 2 are correct. Some of the student might not be confident about 2. So at least 2 out of 3 are correct. Well done. Pat your back and move forward. Because whatever is not coming in your mind will not come in your mind. If you got confused, you got confused. So leave it. It's all right. Now the thing is, whenever they talk about mechanical heart valves, mechanical heart valve will be forever on anticoagulation. So it's their forever anticoagulation is warfarin. Okay, and she wants to continue breastfeeding. They have given it purposely because you might think that warfarin is not safe with breastfeeding, but we know that warfarin is safe with breastfeeding, right? So the score is high because of the blood loss as well as the admission, the prolonged admission, but it's all right. Anyways, for mechanical heart valves, she need prolonged anticoagulation. So once she finished 5 to 7 days after delivery, you have to change her over to warfarin, right? So she need to, the option here might look to you, the warfarin is not at all visible sort of, but when you read mechanical heart valve itself, it should strike in your brain that uh, they need warfarin forever. That's why when they get pregnant, we have to change them to heparin. Then again, at the time of delivery, we have to, sometimes what happened, I'll share with you all that recent, this mechanical heart valve TOG recording, which says when you have to convert in the first trimester and what are the different options in the last trimester and how to change it postnatally, because I'm sure that is very, very important for your exam, because this is January talk. So mechanical heart valve thromboprophylaxis is very, very important to memorize. And here it's an old question. So they have asked you about mainly warfarin. So that's why the answer is warfarin. These are the hint. Another 2 you did correctly, so that's perfectly fine. So as I told you, be easy on yourself and be happy about what you're confident, and don't scratch your brain too much in exam is what will be beneficial. To perform for all 100 questions. You don't have to perform only for 3 questions, or only for 1 EMQ, or only for 1 SBA, but for all 100 questions, your brain should work in the equal capacity and intensity. So it's important that we be stable, confident, calm, without any panic. Great. So presentation always matter, that how we discuss things, how we discuss among ourselves, it helps us in memorizing for a longer time, right? So this is a quick revision of when to stop the prophylactic heparin, when to stop the therapeutic, and when to restart. So whenever you are giving analgesia, you have to stop prophylactic low molecular weight heparin 12 hours before, therapeutic 24 hours before. And then regarding the restart, 4 hours after regional and 8 to 12 hours after regional. This is very, very important exam question, always asked, because this is a practical point. You have to stop 12 hours prior for a prophylactic and restart 4 hours after. For therapeutic, stop 24 hours prior and restart 8 to 12 hours after regional anesthesia or anesthesia, right? Then in exam, they might not give you low molecular weight heparin at all in option. They might ask you about unfractionated IV, unfractionated subcute. So you should remember about that also. So basically the unfractionated is short half-life heparin, while low molecular weight heparin is a long T-half. That's why it's daily dose, while unfractionated is 6-hourly dose. But subcute is a longer one. That's why it's 12-hourly. So sometimes what you're looking for in the option you don't find. Then you have to unfold your brain about the rare of the rarity, like unfractionated, what is the, how it is stopped, how it is restarted, things like that. Usually peripartum period sometime you have to, for a high bleeding risk women, like placenta previa, placenta creta, who is going to bleed higher in the delivery process. If they are on low molecular weight heparin, you have to change them to unfractionated heparin because you can control it better, and there is an antidote for this, the protamine sulfate, while there is no antidote for the molecular weight heparin if they bleed. So that's why this comes in action when in peripartum period she's a high risk of bleeding. Okay, so we discussed already this chart. So as I told you, this is very, very important. Even though the score is 2, they will receive for 6 weeks. So remember this also the same way, that at least 10 days for these, any readmission, any surgical procedure in puerperium, any comorbidity, at least 10 days, and could be 6 weeks. Okay, so that's all about the VT discussion. If anybody has any questions, any comment, please put in the comment box and I'll be able to help you. I wish you all very best for July exam, and those who are starting their preparation for January exam, this is the right time to start with MRCOG. And as I told you, the offer is very good. It gives you 2 courses at the price of $325. For the group, it is 50% off. If group of 2 or more, they can join for 50% off, and you can pay in installment if you like that. For those who scored good in part 1 can avail for scholarship offer. This is the free group link to join. Any queries, you can always message me. And that's all for today. Thank you so much for joining today. I really appreciate your time. All the very best for exam. And please let me know if you're facing any difficulty, need any guidance from me. Thank you.